Hi, I'm Kate Marie from Slow Aging and I'm here with Dr Peter Muzikants to get my veins fixed. I'm noticing increasingly I get a lot of spider veins and I'm come to the Oracle to work out what to do about these things. Hi Peter.
Hi Kate.
And thanks for looking at my veins. And
Pleasure.
I noticed I'm getting quite a number of these spidery veins on my legs. You fixed some in the past. Clearly things just keep reappearing. I mean, do they ever stop?
You will go through periods where the veins tend to appear more frequently or seem to be growing, then they'll quieten down again. It may be the sort of job that you're doing, you may have injuries to the knee, or you may just be genetically predisposed to developing these veins.
So Peter, what are you using? Just have a...
Well, I'm going to be using a hypertonic saline solution, sodium chloride or salt solution. It's very concentrated. Normal saline or salt that we have in our blood is 0.9% salt, so we're using a 23 or 20% or 23.4% solution to do the job for us in sclerosing the veins for you.
So when you inject the vein, do you inject it lengthways into the vein, or?
Well, you'll soon see what I did, but
I don't
basically it's a very superficial injection. It's just really injecting a small segment of vein, and the solution runs through a system of the veins that are connected with the one that I'm injecting. So I may not necessarily need to inject all the veins. I may inject 2 or 3 points, and that may cover all the veins in a particular area.
So how do you know, like when you put the needle in, to say I've got this area here, this round spot, how will you know that you've covered off those veins?
Well, I basically can see where the solution's running. As I inject it, because the solution's like water, the vein empties out as I inject, so I know how far that solution's travelling within the vein system there. Try and pick a larger vein to inject. These are very fine. So these are bordering, if they're perhaps a bit smaller, I would probably suggest a laser treatment on these. So a little bit of a flushing there. That's it. There you go. So this tape stays on for a short while. There it goes. So it flushes through the big area.
So what happens now?
Alright, generally with these smaller veins, we would probably recommend to wear some compression stockings.
Right.
If you've got those, if you don't, if there's only a few small ones, we can probably do without, but if there's a larger number, then we'd probably recommend you wear compression stockings for maybe up to a week. In your case, they're very fine and small. You could certainly try without the compression stockings. I think they'll work probably quite well anyway. And usually tell people not to do any vigorous or strenuous workouts or exercise for a few days too. But apart from that, that's really all you need to worry about. The more extensive veins that you have, larger number of smaller ones where we do a lot more injections in these, then the wearing of stockings becomes more important. We might get you to wear them longer than a week, and we'll obviously need follow-up treatment too, probably in about 4 weeks' time for any recurrence or new veins that may have appeared, and we go in that fashion till all or most of the veins are cleared.
Okay, well, fantastic. Thank you for that.
Thanks, mate.